Hi guys, hope all is well. My name is Dr. Sisnet and I haven't vlogged in the last 8 months. Today I just felt like vlogging, not only because I'm in self-quarantine, but because my channel has had no content for quite some time. So I know most of you who are in the profession, which should be medical or dental profession, have been under some, I would say, what I would definitely call immense stress. And the reason for that is obvious because of the COVID-19 pandemic. For me, it's been extremely stressful as well too. Saturday last week, I came into contact with a patient who tested positive. However, I took the necessary precautions, and I'm very clean in my office. Persons come in, they have to be sanitized, and they have to wear masks and everything. But the right protocol is, once you've come into a confirmed case, is to go into self-quarantine, contact the relevant authorities, and get tested. So I think most persons know the difference between quarantine and isolation. Quarantine is for those who have been exposed to a positive case, and isolation is for those who are likely infected and could be infectious. So yeah, so I'm in the next 2 days, I'm actually going to go for the COVID-19 test, and I'm not looking forward to it, but yeah, I have to take it, and hopefully it's negative and I can get back out into the work world. Currently I'm asymptomatic. I have no cough, no sneeze, but however, we do know that there are persons who can be positive and be asymptomatic as well too. This is just one of those times now that as a medical professional, you understand that the choice chosen, or the profession that you chose, it's not glamorous in any way. We're at the front line, we are at risk. I've had patients who've come into my office, who've asked to take off the mask for whatever reason. I think they think that medical professionals are immune, but we're not. So it's been the hardest time period to practice as a medical doctor. And I think dentists themselves have been either closing their offices or limiting their practices as well too. I've had so many conversations with patients where I've literally had to tell them, like, please practice certain protective behaviors. For one, they come into the office, they touch up their mask, and they're touching the mask and touching things. And honestly, medical doctors and nurses and PCAs, or patient care assistants, pretty much anybody that is dealing with the general public, you're at a serious risk. But that's the life we chose. As for my dental school career or dental school path, I'm no closer. The economy has shut down here in Jamaica for the most part. I mean, it's slightly opened back up in the last week, and next week they're supposed to ease some of the restrictions. However, we don't know what could happen between now and next week. We've seen in Europe that some of the countries that have eased their restrictions have actually ended up having a spike again in the number of cases. So we'll see. I know most persons on the channel will be somber, a little frustrated, because those that are students, you would be in limbo, because most universities aren't in play right now. Most universities are actually doing online classes. But if you're in dental or medical school, dentistry and medicine cannot be done via Zoom or Skype. You can do little cases, you can do certain things to try to keep abreast of the information, but in terms of your hand speed and your hand skill and your clinical skills, you need to be on a ward. And most persons, especially dentists, dental schools, they're not in full swing right now. It's a very scary time. I can't even tell you when I will be going back to school, because I don't know when the persons who are supposed to graduate this year will be going back to school. So there's no way of me telling you anything. And honestly, like, that's the least of most persons' thought processes right now. Most persons are worried about how they're going to pay their bills, because most persons either have been limited in the number of hours they can work, or they are not working. If you're a student and your parents have stopped working, that means that your artery to your education has literally been cut. So, yeah, it's a rough time to be a student. It's a rough time to be a medical doctor, nurse, any medical professional, or any person in the public sector dealing with the public. I saw a lot of persons on the channel asking about whether or not to do PLAB, MRCS, USMLE, FRCS. I hope I answered your questions very, very promptly and very, very accurately, and I hope that you have made your final decision and you've stuck with it. Me personally, as I told you before, I'm still in between three of the choices to go and train, which should be United States, UK, and Canada. United States seems unlikely because it requires a large sum of money, which I am just not about spending any more money right now outside of school. Canada seems to have scholarships open. Not certain how feasible that is though, because some of these scholarships, I don't think they're that easy to get. And the UK is pretty much the only one that still is open right now. Australia has some places too, but I'm not going that far. But I hope you continue to subscribe. You can ask me all sorts of questions on my email, or in my email, or via my email, or you can ask me on the page. I hope you are well. I hope your family is safe, and please continue to subscribe.